Hello, my name is Robert Kennedy. I'm a pharmacy manager at Walgreens in the Legacy Clinic in Houston. It is an HIV, predominantly HIV clinic. I've always had an interest in HIV ever since the beginning, really the beginning of HIV. Seeing so much change in HIV since day one, since they had one drug. I've been a pharmacist throughout the whole disease. When it was just the one drug, there was not a lot of success with it. When they started coming out, it wasn't long, they started coming out with, one more drug. When they started bringing out the protease inhibitor class, that was a huge advance, and you saw people doing a lot of basically turning around. Instead of progressively getting worse, they were actually getting better and being to function in a normal life. The new classes of drugs seem to have far less side effects, and so it's very hopeful. The older side effects, you see people with a lot of nausea, a lot of diarrhea, serious abdominal side effects, something that was hard to deal with on a day-to-day basis. There were also other side effects. There were long-term side effects. Crick's belly, which would be, fat redistribution in their abdominal area. They start getting really thin in the legs, in the extremities. They have fat storage on the backs of their necks, in humps, breasts, all kinds of things that kind of disfigure them and make them basically stand out in the public. People could actually look at them and go, hey, I bet I know what that is. All those side effects are still exist in those drugs. So it's all a matter on what drugs you're on. So when we got the new integrase inhibitors and the cell binding inhibitors that are coming out, you're going to see a lot less of that because they don't have that side effect. So there is hope for people to have all these disfiguring side effects. They can go to something that doesn't have those. Compliance, depression, things like that. People are depressed about it and they think it's never going to get better, or they get depressed about other things in their life and they think, why take the drugs? So you've really got to stay on top of patients and make sure that they're staying on their medications, because as we all know, things get better. If they're on their medication and taking them correctly, they will be in every month. We have patients that come in almost on a daily basis for some reason or another, and sometimes it's just to say hello, they feel comfortable in this clinic setting. If I get somebody that's been newly diagnosed, I usually sit down with them in a counseling room where it's just one-on-one, and we go over the new drugs. We talk about the whole HIV situation, what their thoughts are, make sure that they are listening, comprehending, because a lot of times they'll be in shock. And you need to get past that, make them feel comfortable, get them to relax, and let them know that this is not the end. This is just something that we've got to manage, just like blood pressure or diabetes, but you've got to take the medication. Years ago, it was a death sentence. It's not so much anymore. It really isn't, and it's something that can be managed, but you've got to do what you're supposed to do. If you don't do that, you run out of medications. And it's nothing to be scared about, but it's just something you've got to be serious about, because there's a big difference. I use all the drugs as a group, as in your bank, in a bank account. Everybody understands money, bank account. When you run out of money, you're broke. Same thing. You've got a whole bank and it's full of all these drugs that are available for HIV. If you don't take your medication right, you develop resistance, which means you can't take that one anymore. Sometimes the entire class. Those things get taken out of your bank account and you've got this left. And if you screw up enough, you mess up enough, you're going to end up with nothing in your bank, and that's when you run into trouble. The thing is you want to stay compliant on your medication, take it the way it's supposed to, don't miss doses, so your bank stays full. You don't have to worry about it. You've always got something in the future. There's different ways of missing doses that are worse than others. If you miss, obviously it's worse if you're taking a cocktail. If you take 2 and not 1, that's worse than not taking all of them.
Why is that?
Because your resistance is going to be on those 2 that you're taking. You're going to ruin those 2 drugs. You're going to develop resistance to them. If you take all 3 of them, take nothing for like a week or 2, it's better than missing them once every week because of the resistance. always, it's a barrier method. Use condoms. Sometimes latex condoms is the best thing. You need to use them for everything as far as any kind of sexual contact, whether it's oral, whether it's vaginal, whether it's anal. You need to use a latex condom. This is a tough thing, especially for young people. You've got to assume everybody can give it to you. So you've got to be careful every single time. You can't be unsafe one time because it can happen at one time. Especially really healthy people can go through life thinking that nothing. They're not going to get it. I never get sick. My immune system's strong. It's not strong enough for this. Work around a lot of HIV people. You see, it really does change your life. It's not the end of your life, but your life does change. Well, the main thing is a lot of people think that now that there is so many medications available that it's not that important to be safe. And what I basically want to stress is that yes, there are a lot of drugs available, and it is better than it was, but it still affects your entire life. So it's not an easy road, even with the medications. You can have a healthy, great life, but it's going to be different. The new generation of people coming up weren't around when people were dying from this, and they see it as something that's not as serious as it is. Because there's so many medications, and because it is a controllable disease, that it's not taken as seriously as it used to be. And so people aren't as safe as they used to be. We're seeing a big rise in heterosexual people in HIV. A lot of people still think of this as a homosexual disease, and it's not. The key to the disease state is education. Everybody needs to be educated. I mean, you can talk to your healthcare professionals, somebody that you can trust. It's always somebody you can talk to. So I have some patients here that are probably going to live to be in their 80s, because they take good care of themselves, they've got a good immune system, and they probably have a weak strain of the virus. It all depends. If you've got somebody who's reckless or somebody who is not safe and get reinfected, they're not going to have a good chance because they've got a lot of things to fight. Actually, the thing that changes people's behavior most is to actually witness the disease, actually see people, talk to people who have the disease. You learn a lot more that way.